announce this year's first place winner. And I think that's a truly impressive accomplishment given the quality of this year's field. So I'd like to ask everyone to please join me in congratulating Weill Cornell. This award, this first place award, comes from our sponsor Hologic and Asahi Intech. And this award will be $29,000 of in-kind services. So again, congratulations. And I'd like to introduce Tamitha Fenster, who will give us a presentation on this year's first place winner.
Okay, hold on. Hold on a second. That's amazing. I'm sorry, this is really great. Thank you. Thank you. Okay, hold on a second. Where's my husband? Wait, hold on. Thank you so much. Such an honor, so kind, and we're really humbled because there were such wonderful companies this year. So really an honor. You know, it's been so hard for people in the medical system. So thank you for doing something so positive and uplifting this year for us. Really appreciate it. Thank you. Okay. So thank you. I'm the founder of Smarter MRI, where we make MRIs brilliant. As a gynecologic surgeon, I've seen 30-year-olds struggle with infertility, 40-year-olds in crippling pain, and 50-year-olds in my emergency room with profuse vaginal bleeding. These women suffered from uterine fibroids, which are the most common benign tumors in women. Fibroid treatments such as surgery total $600 million a year. They disproportionately affect African American women, with 60% developing tumors by age 35. Currently, a patient comes for surgical consultation with MRI images. The surgeon reviews the images, sometimes sketches the anatomy, and makes a decision if she should have open or minimally invasive fibroid surgery. Intraoperatively, the surgeon used printed out MRI slices taped to the wall as a guide. These rudimentary imaging methods contribute to problems. Preoperatively, it can manifest as an unconscious bias, where certain patients are not even offered minimally invasive surgery. Intraoperatively, poor guidance leads to difficulty locating tumors, subsequent long surgeries, and increased blood loss. We knew we had to make a solution better for women. Smarter MRI is that solution. This end-to-end software automatically generates 3D renderings of fibroids. We can then use these sophisticated images to counsel patients and plan our surgical approach. Residents can interact with the exact anatomy in the simulation lab. Intraoperatively, we can integrate the technology with robotic and laparoscopic platforms to efficiently find fibroids, which leads to faster surgery and less blood loss. Faster surgery by just 10% will save the hospital over $15 million per year, with a CAGR of $93 million over 5 years. But what makes Smarter a complete solution to surgery's limitations is the integration of artificial intelligence. The software will make quantitative predictions on blood loss, surgery length, and likelihood of benign or malignant pathology, even automate decision-making for patient referrals for minimally invasive versus open surgery. A very sad reality of my field is minorities are less likely to be offered minimally invasive procedures. Smarter would provide minimally invasive referrals based on objective data, imaging without racial bias. Compared to existing technology, ours would be the only software that automatically renders 3D gynecologic images combined with the benefits of artificial intelligence. Stationed in a major medical center, we have access to a wealth of clinical knowledge and technology to train our computer systems. We would license our technology to insurance companies and hospitals, motivated by a potential uptick in ambulatory cases, unbiased referrals, and a cost savings of efficient surgeries. To date, we have filed a comprehensive provisional patent that covers fibroid removal surgery but with the data and the AI acquired, it would be applicable for all gynecologic pathology. We have generated a library of over 100 MRI scans. We have a working prototype, and we are starting our clinical trial. This is a 510K device. The generous prize we received would enable us to further our software development. I had an infertile patient with massive fibroid uterus and a distended belly, and she was devastated because, ironically, people kept asking her how far along she was in her pregnancy. We performed a laparoscopic myomectomy, and a year later, she said to me, "Finally, people offered me their subway seat for the right reason." So this is my amazing team, and without them, certainly we couldn't have put this together, and we're just so flattered and honored, and really can't wait to work with everyone there. Thank you so much.